My name's Angela. I'm the Macmillan physiotherapist here at the West Suffolk Hospital. Today we're just going to give a bit of an overview of what prehab is. Prehab is something that's offered to a lot of people sort of prior to surgery and treatments. Here in oncology we offer it before somebody may be starting radiotherapy, chemotherapy or having surgery. The idea is to get you in the optimal place in order to have those treatments, and that's looking at your physical, mental and emotional well-being. So the idea is that we have various different people in the team involved, which we will all come together as an MDT, which we're going to show you in a minute, in order to be able to sort of help build you up. That might include having exercise, might be including nutritional advice, it might be sort of some counselling and emotional advice to be able to cope with the journey that you're about to go through. So today we're going to do a mock-up of an MDT, which is the multidisciplinary team meeting. Unfortunately, we've not got a doctor present with us today, and we don't have a dietitian either, but they would normally be involved in this. Welcome everyone to today's MDT. I'm Angela, the physio.
I'm Julie, the manager of the Information Centre.
My name's Michelle and I'm a cancer counsellor.
My name's Sarah, I'm one of the lung cancer nurse specialists. I'll take it away. So we've got a female, a 61-year-old lady to discuss today for prehabilitation. She was seen in clinic. A CT has found a 12mm spiculated right upper lobe nodule. We're concerned that this might be an early lung cancer, and she's provisionally been staged as a T1B N0 M0. She has a past medical history of COPD and osteoporosis. She does have severe emphysema. Her FEV1 is 0.83 litres, which is 36% of her predicted, and she is on treatment for her COPD. She's considered high risk for a biopsy because her lung function is not where we'd like it to be. We plan to refer her to Papworth Hospital for a PET scan, and then to guide further management. So the treatment options could be surgery versus radiotherapy. So we kind of want to discuss how we can optimise her in preparation for those potential treatment options. She is an independent lady, so she's able to do all of her activities of daily living, but she's not quite as active as she was before. She's been experiencing fatigue, and she's also had some deconditioning after a long admission with flu. So we feel like she might benefit from some physio input. She has a low body weight as well. She's 39 kilograms, but she has already been referred to a dietitian, and there's a plan in place for that. She is a current smoker as well, but has accepted a smoking cessation referral. She's very engaged and committed in terms of improving her function and activity levels in preparation for treatment. She feels emotionally that she's in a good place now. She's living with her sister, and they're both prepared to kind of go forward and take on the treatments that are going to be offered to her.
Yeah, well, certainly from a physio point of view, I think that would be a very relevant referral through to us there. We can offer her sort of an exercise session, probably get her in initially for a face-to-face appointment, maybe with her sister, so her sister can sort of help support her. We'd obviously have to look at the exercise. We'd be looking at doing some cardiovascular fitness and a little bit of sort of strengthening work as well, which have been shown to really help. But I'd maybe do that as an individualised programme at home initially, just increasing her activity levels so that we're not going too hard, because obviously she's got that the COPD and the osteoporosis, so we need to really make sure it's catered to what she needs, but then ultimately maybe looking at introducing sort of some other hobbies and things that she might like, and also I'll do the fatigue management as well, give her some sort of strategies to cope with that. The fact that she's got the dietitian involved is really good, because hopefully she's then getting enough nutrition to be able to support increased activity levels. So, and then I'll just feed back to you once I've had a few sessions. So.
Excellent.
So it sounds like the patient is coping really well. What I could do is offer single session therapy as and when she requires it, to address any worries and offer tips and coping strategies to manage any stress and anxiety.
Yeah, that works really well for us at the centre as well, because obviously we'll be taking the phone calls and coordinating it for the patient. So, and at the same time, because we know with a cancer diagnosis that there are other problems other than your treatment that come along, we can be there to support them as well. So, yeah. all works in well together.
So thank you very much. I will put all of the referrals through to the appropriate areas for prehab, and you can then contact the patients directly
Yeah.
and take it from there.
Yeah, lovely. Thank you very much. Yeah.